Hi, we are Group 11 and we will be discussing our intervention Hookah Free Live Free, which is a health education intervention to reduce hookah tobacco smoking among young college males.
First off, our main goal is to increase awareness on the health risk of hookah tobacco smoking among college fraternity males ages 18 to 24, ultimately educating the participants and correcting any wrong beliefs regarding hookah.
Evaluation questions were developed in order for us to analyze the effectiveness of this program. The questions included: what percentage of participants were able to identify 2 key health risks attributable to HTS? Second, what percentage of current smokers will have reduced or ceased tobacco usage? Third, what percentage of non-smokers will have maintained a tobacco-free status? Fourth, does the dosage of the intervention affect the behavior of the smokers? And finally, fifth, does the prevalence of HTS differ between different fraternities?
Using the theory of planned behavior as the framework for our conceptual model, we will be focusing our analysis on smoking behavior, which is our health outcome that we will be measuring.
For recruitment, we used a convenience sampling since we needed certain characteristics in each cohort. The instruments we used were questionnaires that contain Likert scales and categorical, so it can be easily coded and analyzed. We will measure at baseline, post-intervention, and then a 3-month follow-up, which can be seen in our evaluation design, which is a non-experimental time series design.
These are our primary and secondary outcomes that we will be analyzing. The independent variable in this study is the intervention. Our primary outcomes, or dependent variables, are 1. Hookah tobacco smoking cessation after 6 weeks, 2. Hookah tobacco smoking cessation after 3-month follow-up. The type of variables we used are nominal. For example, type of smoker, answer yes or no. Our secondary outcomes are participant able to identify at least 2 key health risks attributable to HTS, and our independent variable is the intervention.
This is a table including all the data for our intervention. As you can see, we have a sample size of 10 participants ranging from 18 to 24 years old and from 2 different fraternities.
We initially conducted a univariate analysis to look at our first 4 evaluation questions. As for some descriptives of our sample, 100% of the sample were male, the average age was 20.9 years old, the percent able to identify 2 HTS health risks were 90%, the percent of smokers at baseline that quit at the 3-month follow-up was 80%, percent of non-smokers that maintained a tobacco-free status at the end of the intervention and at the end of the 3-month follow-up was 100%. To address our 5th evaluation question, we did a chi-square analysis to compare the final smoking rates by fraternity group. After running the chi-square, the p-value was equal to 1, which is greater than the alpha of 0.05. Thus, we found the results to be statistically insignificant. Our chi-square value was 0, with 1 degree of freedom using a sample size of 10. We concluded that no matter what the group is, the results of the intervention are consistent across these groups.
Overall, the program was a success because the majority of participants who were smokers at baseline quit by the 3-month follow-up. Also, those that were non-smokers at baseline remained non-smokers. The participants who seem to have gained more awareness of HTS and its health risks and will be planning on sharing their knowledge with family and friends. Although the program was a success based on our objectives, there were some limitations with our study. The first is since this was a small sample size, it can't be generalized and is not representative of the larger population. Also, since our design was non-experimental, we had little control over the factors that affect the validity of the results as compared to a randomized controls trial. Therefore, we recommend that for future studies to use a larger, more diverse sample size in order to achieve more significant results.
The Hookah Free Live Free team thanks you. And these are our references.